Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody. Welcome to the Hanley Effect. I'm John Dybin.
I am Rachel Dosical. Hey, Dr. D.
Hey, Dr. D.
How you doing?
I am quite well. Very excited. There's so many good things happening in our community. How are you doing?
I am doing great. Thank you. We have one of my favorite people on the podcast today. I am super, super excited.
And you mean me?
Well, I did mean you.
I'm sorry. I'm just checking.
Yes.
Who did you?
The first.
Who did you really mean? Who is our guest?
I meant Renee Layman, who is the CEO for the Center for Child Counseling. And before we start, I'm going to tell an anecdote about Renee. So Renee was in my Leadership Florida class, and for those of you who have done Leadership Florida, you know that throughout a year, about every 2 months you come together. So 6 times you come together, and there are 50 esteemed leaders from around the state of Florida. Okay. So we climb on the bus the very first time. I don't know Renee, nobody else does. And they say, would you like to say something interesting about what's going on at your professional workplace? So Renee puts her hand up and she stands up and she says, I just got a federal grant today. We're like, oh, very nice, very good. So next time we get together, we do the same thing. We get on a bus and they say, would anybody like to stand up and say something interesting? So Renee puts her hand up and stands up and says, I got another grant today. Yeah. So then the third time, same thing. Fourth, really, it became a joke.
It was a joke in the class.
It was hilarious. So by the sixth time, everyone was saying, okay, Renee,
Where's the grant?
Did you get another grant? Did you get another grant? And I can't remember. Did you get one 6 times?
I don't think it was 6 times. I think it was about 4 of the 6 times.
It was crazy.
Yeah, so that was just really fun. A lot of fun.
I mean, that's pretty impressive.
It was pretty impressive. It was pretty impressive. And, truly, it became one of those rallying calls. And where's Renee and the new grant?
and can she write them for, everybody?
I could, but I won't.
You have to sleep. You have to sleep sometimes. It'd be a little like Oprah. You get a grant. You get a grant. But
it's like the favorite things.
That's right.
Yes. Renee, tell us a little bit about yourself and the Center for Child Counseling, and then maybe later on, I want to talk about ACEs.
Okay. Well, I have been president and CEO at the Center for Child Counseling since 2013, but really in the mental health nonprofit field for almost 30 years in Palm Beach County. Just never wanted to be CEO of an organization, but it just led me there, my career path, and a wonderful woman that I met, Jane Robinson, who's the founder of the organization.
So great.
She's trained so many mental health clinicians in our community. And so when she was retiring, we had lunch and she said, do you want it? And I was like, sure. Didn't know what I was in for. But since that time, we started with 4 staff. Now we have over 90 staff, and we've really grown to fill critical gaps in the community.
And my understanding is you're always running on a waiting list. So you could take 90 more or?
Absolutely. So one of the things that we started in 2019, because pre-pandemic, our wait list was typically maybe around 100. Coming out of the pandemic, it was 500, 600, 800, 1,000 kids. But we had started a process in 2019 of really mapping out a data dashboard to measure our public health framework. So we provide the typical children's mental health treatment, but we also work at prevention and early intervention. But it's really hard to prove prevention, right? How do you know in 10, 15, 50 years whether you really helped? And we wanted to measure that. So we started that process, and then during the pandemic and coming out of the pandemic, we had to change the data dashboard a bit. And throughout everything that we do, we use that public health framework. And within 3 weeks of implementing that throughout our organization, we had over 800 kids on the wait list, and it went down to 340.
Oh my gosh.
Just showing that, because the
Wow.
typical mental health treatment model for a children's mental health organization, you get the referral or parent calls in, and you do the full biopsychosocial treatment plan, typically diagnosis, bill Medicaid or insurance. So that's the typical model. But shifting it to that public health framework and having everybody come in through that prevention lens. Here's anything. If you're a parent or a caregiver that just needs effective ways to talk to your kids about grief or divorce or the loss of a parent, you can do that. So building the capacity of parents and caregivers to have those conversations, that was a game changer for us. And then if they needed a little more support, we saw that a lot of the parents and caregivers were calling in, or they were just dysregulated, right? Not able to really have those conversations effectively. So we got in appropriations, and within our model, we have a level of mental health consultation. So providing free mental health consultation to the adults in the child's life. Not even without even seeing the child, right? So we're building their capacity to mitigate those behaviors, whether it's behaviors at home or school, or just going through tip sheets, or our way of being with children manual. We have all of these resources that our education and prevention services team have developed that enable us to have those conversations, whether it's a teacher in a classroom or a parent that's calling in.
Amazing.
It's a true health model. It's
Absolutely.
a true, we have gotten so pathology based and focused on, okay, someone brings a kid and we say, okay, let's diagnose this kid. And what's the problem with the kid?
Yes.
But we exist in families. We exist in systems. And you're actually, again, we're seeing great organizations like this. You're going out and saying, actually, let's find what we can do to put in the supports in the system.
Absolutely. And anybody can go onto our website, and we developed bekidssafe.org, which is an online learning platform that anybody anywhere in the world can log on and get our Stay Kids Safe curriculum for free. And that's preventing child sexual abuse, exploitation, and human trafficking, or just enrolling in a different workshop. But we have a feelings and coping curriculum. We have Camp Safe. So you imagine your child goes to camp. They're with an 18, 19-year-old camp counselor. Oh. Well, your child could be at risk for sexual abuse. And so we have camps from all over the nation enroll in that curriculum to train their camp counselors.
Wow. And that's when, we joke about you get a grant and you get a grant and you got a grant. But for people who are listening or watching this who may not understand that, when you talk about getting a grant, that's what you're talking about. You're talking about getting funding to create programs that really help people and that really protect kids.
Absolutely. And now within our data dashboard, we almost have 10,000 kids in the data dashboard.
Oh, wow.
And we can geomap it, right? So that's been real labor of love for our team. But we can, when you talk about grants and even donor dollars and how we're using it, we're now using a data to action framework where we can look at the data on the street level, zip code level, presenting issue, age, any demographic that you can imagine. And I recently, last week, pulled the data for 33401, for example. 300 kids that we serve in that zip code have 4 or more. 42% of them have 4 or more adverse childhood experiences, ACEs, right?
So talk to us about ACEs and what that means. This is so key to the work that we do at Hanley. Because we know that those kids with 4 or more, if they're not treated when they're with you, they're going to end up with us.
Right. And it's not just treated with, so you can buffer the impact of ACEs. And so, when I started this work, it was really that treatment model. And then quickly realized you don't have to go to therapy if you've had an experience. And that ACE is not necessarily traumatic. Those buffering relationships, the positive childhood experiences, are just as powerful as the ACEs. And so much work around ACEs does not tell that story.
What are ACEs? What are we talking about?
Adverse childhood experiences experiences, Casa Permanente and the CDC did a longitudinal study where they looked at these experiences that happen before the age of 18. And they found that if you have 4 or more or 6 or more ACEs, it's related to not only mental health concerns later in life, but also physical health concerns.
Give us an example of one or two.
Diabetes, heart disease, obesity, cancer, all linked to these unbuffered, and that's a really important word, unbuffered adverse childhood experiences.
And those experiences are things like experiencing violence in the home, experiencing divorce, there's several of them.
A parent with mental illness
Yeah.
or substance misuse or addiction. There are all of these types of experiences. There are 10 that they studied, and then we have others that have not been, but we're screening for those also.
So you're getting, identifying when children have it's kind of the piling on, and it's correlated with all of these later life, both mental health and physical health problems, and you're getting them right now.
We're getting them through our infant mental health program when the mom is pregnant. So if you're screening
before they even happen,
because it can pass, it can be transmitted to the developing baby, how their DNA is read and transcribed. So screening the mom for her ACEs and really being able to work with mom, and then when baby is born, that you can work with mom to have that healthy, nurturing relationship with her baby. That's where it really starts.
I love this so much.
Yeah.
So, a few weeks ago, we spoke to Michelle Gonzalez from Healthy Mothers, Healthy
Great
Babies.
partner of ours.
Oh, she's such a great partner.
Yes.
And, the work that she's doing, the work that you're doing, the work that we're doing on Casa Flores with pregnant women, it is really getting in front of these ACEs or potential ACEs and making sure that family is healthy, especially when
you're breaking generational cycles of trauma with doing that. It's incredible. It's just so powerful. My career started at South County Mental Health Center, working at the SRT program that was in the old A.G. Hawley building with, do you remember that?
I very much. That just adds to the question. Now I absolutely remember that.
Yes.
And I was doing therapeutic intensive on-site services back then, in some of those programs and in the foster homes back there and the shelter and all of
Right. So working with dually diagnosed adults in the short-term residential unit, which is what SRT stood for, and I was a mental health tech, and then I was an activity therapist. But my career, I did that after getting my bachelor's in psychology to see what I really wanted to do. But my career has gone from like adults to teens to young kids, and then it's like, okay, we need to get them as babies. Oh, we need to get the pregnant women and the babies, and then follow them, because that's just where you get more return on the investment of these interventions and support.
And where that cycle gets broken early.
Absolutely.
So I want to go back to something Renee said. So you're screening the kids, and you can do some geo mapping. So are you seeing things like, I'm just even thinking, you can look at heat zones, and, areas that have very little nature and trees, and where the temperature is literally higher by a couple of degrees than the rest of the county. When you look at at-risk areas of the county, living in systemic poverty is traumatic. It is traumatic for children. And talk a little bit about what you're seeing throughout our county when you look at the
and we know
geomapping.
the zip codes, right? And that's really where our model, we have our 4 office locations, but we really embed within the communities. So we have 35 co-locations throughout Palm Beach County.
35?
35.
Wow,
that
that's
we
amazing.
are on site, not only a therapist or 2 therapists, but also our education and prevention services team, that we're there providing. Our model is to build the capacity of all of the adults who work and live with children So training them on PACEs, positive and adverse childhood experiences, trauma-informed care. We have our whole A Way of Being with Children curriculum. That's a child's in front of me now. That's what we do to be trauma-informed, because we go to a lot of workshops and it's like, what do I actually do when a child is melting down in front of me? I don't know how to deal with this, right? So we focus on them first, whether we're at a school, and now we actually have a community, a new partnership with Azure community. So we're embedding all of that within those zip codes. But throughout, we have resources available for any parent, any caregiver throughout the community. But of course, as a nonprofit, we focus on the most vulnerable children and families. And then filling those gaps, it's really exciting to see what the data is showing us and coming up with some really fun solutions. One of our donors has just helped us purchase our first mobile unit, which will be more of our prevention, safe space, like fun place that kids can come, whether it's parking in front of a school or our UB Kinsey Education Center in West Palm, and during the summer, and just having physical health and fun and outreach and book reading. We had a meeting with Rohi's Readery with Pernod, and just planning some really fun things so kids can have safe places to go to. Safety is the linchpin of healthy development, right?
That's
and
right.
If we don't feel safe in our schools, in our homes, in our communities, we're really not going to really develop in a healthy way. So that's what we're trying to promote.
Oh. So you all have collaborated on our new children's program, right?
So we are.
It's been buzzing around for us
right.
too.
and actually,
yes.
we're going to have I need 5 minutes when we're done here, because I have a collaboration idea that you just
inspired.
With our
staff, yes.
But you know, the 3-day children's program that we have, you know, we know that when it comes to families where there's addiction, right, that the kids are the first to be affected, and they are the last to be helped if they get any help at all. And you're there, and we've worked with Jerry Moe and NACOA in the creation of a 3-day children's program, and you know, there's been a theme in so many of the community partners like you that we've talked to, and the theme is nobody can do this alone.
Right.
And so, having relationships with, one of the things that our kids need, they come to this amazing 3-day program. They learn so much. The adults in their lives also have a part and get to communicate. And then the question is, where do we go now?
Yeah,
now
that's right.
what?
How do we
now
extend
what?
it?
And so having relationships with you and being able to say, well, guess what? We've got the UB Kinsey, and we've got the things that you guys are providing is just critical.
Right. Or even like connecting to the school district, who's where, right? So there are lots of co-located behavioral health professionals, but also lots of just resources. And I think most people don't know about them, right? There's this perception that we don't have enough. I think just we don't know enough, or we're not making enough connections.
That's right.
And so making sure we're all collaborating. And perfect example of that is I do a lot of work with pediatricians through the Pediatric Society and Palm Beach Pediatrics. And the model, we have a pediatric integration model, and it's just seeing that they just didn't know about the resources, or the family would go back after a referral and say, oh, they didn't follow up. But through our experience, we may have been playing phone tag, and there may have been 6 calls, and it's just like not that connection, but the resources are available.
I hope everybody who's listening will forward this to somebody. Will because you're so right. There are a lot. There's never enough resources,
right?
But there's a lot of resources. I think even this children's program, this amazing thing, and so many people don't even know it exists. Right. So anybody who's listening, my hope is that you'll send this to somebody. You'll let them know that help is here. It does exist.
We have such rich resources in Palm Beach County, and rich collaborations, and nonprofits doing such exciting things. I'm proud to live and work in Palm Beach County, but I think we need, a lot of us nonprofits, we just speak to each other, so we need to figure out how to make sure everybody, like podcasts like this,
like you being here.
Yes,
that's right. So our children's program is free, But
right?
it is funded by a grant.
That's exactly right.
So
Right.
it's free to the participant.
Absolutely.
But we really need that donor support because it makes it possible.
Right.
Makes it possible.
Yeah, our whole data dashboard, that's from a donor. And that was when he learned what we wanted to do and his vision. And then when he saw the geomap and saw these dots all over the county and looking at some of the gaps, and we went down to one street in the community where I think there were 7 houses that kids were receiving services, and just wondering what's going on in that community. And we're not seeing much else. So the idea with the mobile unit, like really being able to go more into the community, and partnering with Palm Beach Pediatrics, we're looking at not only the mental health screening and support and education, but also the physical health for families that may not want to go to the Department of Health or medical provider. There might be some mistrust there.
And I understand that. When we started Casa Flora as our program
Right.
for pregnant women who were dealing with a substance use disorder, and we're still seeing this, they didn't want to come forward. They were afraid that their baby would be
But that's a real fear.
taken
That's right.
away.
Right? That is.
That's
they
right.
would have
Absolutely.
to surrender parental
Yes.
rights. So,
Which they do not.
Which
if
they
they
do
are
not.
in
So
care
that's-
and in
With
treatment,
us, they do not.
Yes.
and baby's there with them.
That's incredible.
It's amazing.
Yeah, it is.
Love that.
It warms my heart to go over there,
Yeah.
and it's just, it's amazing. I'm just wondering how often, does your team work with parents who are dealing with substance use disorders or mental health themselves, and it's having an impact on their children?
That's a big part of what we do, and we screen for what may be going on within the family, because that adult is the most important person in that child's life. So that's where providing either individual treatment if mom's going through depression or there may be something going on. That's a part of what we do. We use dyadic models, so it's not only about the child or the teen even, it's about the adults that they live with.
family,
Yeah.
Yeah.
So things like filial therapy, child-parent psychotherapy, even the play therapy, getting the parent in the actual play therapy room with the child, teaching them the strategies to use with the child, how to play with their child. That's the most important relationship, right?
In our children's program, that is, there's a very specific point where it's parents and kids and playing, and it's the breakthrough point. It's a magical thing that happens.
Beautiful. It really is.
Can I take a liberty to
Yeah.
all right, so I always want to know the why. So you have, and anybody can look you up. They can read all of your biography and your whole history. You have spent your whole life dedicated to mental health, to the community. It's funny when you talked about the program that you started out in. I mean, I know that program. I know that's as hard boot camp work as it gets. Tell us about what is it?
I loved it, by the way.
That in itself says a lot.
Yes.
Where does this come from? Where does this passion for mental health, for the community, for service?
It just evolved. I grew up in the Bahamas, boating, and wanted to be a marine biologist. Started my UMass biology.
Really?
I didn't know that.
Yes.
Oh, how funny.
You learned something, right, today. And I took a psychology class, and I absolutely loved it.
And the rest is history?
History. Loved it.
Wow.
Loved
That is
it.
so great.
And then after my master's, I did my internship at Tyson Teens in Martin County. Then I did private practice, and I did the equine assisted psychotherapy and all of that. But I did some work with Place of Hope and then parent-child center. And I just really, I'd have kids come to the barn with the horses that I had through the horse foster care system, and just loved working with the kids that maybe had never interacted with a horse before, or just really had, when you talk about ACEs and trauma, it just clicked to me that, wow, this is almost like just intensive rehabilitation at some point, right? Yeah. So I liked that more than the kids that came to the barn with their jodhpurs, their tailor-made boots and jodhpurs, which is fine. That's good too. And I started doing more work in the nonprofit, and it's just gone from there. And just absolutely, I love what I get to do every day.
Your passion is so.
It's my life. Yeah. It's not a job.
Amazing. It's amazing. I want to know just a little bit about the positive childhood experiences. So talk about the buffering. This is a very, very important concept.
Very important. I've spent last year going through the HOPE framework training that was developed at Tufts Medical. And so now I'm a HOPE champion, which is healthy outcomes from positive experiences. Yes. And really making sure that we are buffering the impact of ACEs with these positive experiences, and having the people that live and work with kids to understand that they can make a difference. We talk about it as the antidote to ACEs almost, right? That you can change a child's life. And how do we promote that? What does that look like? And they have the building blocks of HOPE, and we've incorporated the PCEs and the HOPE framework into our screening process. Actually, that's the front-facing part of it, because we were screening first for like trauma and ACEs, but shifting it to more of a strength base. It's not as triggering, it's not as scary, it's more of like, okay, what are you doing really well with your child? So that we've changed last year, that's how we changed our intake. We've looked at our HR policies, everything that we're doing as an organization, our new strategic plan, it has HOPE all over it. And really taking that framework with our staff, with families that we serve, and with our community. And we have a new county grant that we're providing training to schools and organizations.
So one of the components of our capital project right now is we're raising money to open a small early learning center that is that is going to focus on children who have been exposed in utero and exposed to substances in utero. And the HOPE model is one of the things that we want to bring into this broader framework of this early learning center. Yeah. It is, it's really transformative. And, we have a mom and a baby with us right now that the story is well, it's a happy one now, but it was challenging at first. Mom was pregnant and using. She was arrested and she was put in jail, for using. And she started to detox in jail, and it was an opiate detox, and it was very, very harmful to the baby's brain. So when baby first, mom was with us for a little bit pregnant, and then when she gave birth and the child came back to Hanley with mom, there were a lot of signs of, having been not only exposed to opiates, but it's really that quick detox that hurt the baby's brain. Today, several months later, the baby is thriving, and it is because of really all of these positive interventions that have been part now, including the attachment and the nursing and the all of those things that are really surrounding this baby with what she needs to thrive. Right. So I love that you're doing that.
Yeah. Love it.
Amazing.
Love it.
It's amazing.
So we're unfortunately coming to that time where we have to begin.
It goes so fast. It goes so fast.
You know, it's funny. We always remember to thank our military and our first responders and stuff, but you've spent a lifetime serving our community, serving people who are struggling, people who are kind of at their lowest. And so I just want to thank you, and we want to thank you for your decades of service to our community
Thank you.
together.
Same to you. I mean, it's just, it's a love, it's a passion, and
It's a passion.
love the children and families that we work with, get to serve.
It's an honor.
It
It's
really
an honor
is.
to
It
serve
is.
them.
We always like to give our guest the last word. And so I want you to think about, there's a lot of different people, professional and non-professionals, and all sorts of people that listen to this or watch this. And I just want to give you an opportunity. We always like to give you a chance to say, what message would you want to give to the listeners, whether it's people who are struggling or whether it's just our community in general? What would you want them to hear from you today?
Everybody has a role in what we do, right? With whatever they do, whether they work in a business or a not-for-profit or a school, we can all make our community a better place to live. And just reach out to any of us, I think, if you want to learn how to do that. But that call to action now, I feel like we have so many families and kids that are struggling and need. We have a youth mental health crisis. We have a parental mental health crisis. The need is so great, but you can do something for a friend, a child, even yourself, right? There's hope, there's help, and take care of yourself, right? Right now, I think that's more important than ever.
So I just want to say again, the Center for Child Counseling is a remarkable place. I mean, you really have resources, and how would those parents reach out to you?
They can go to our website, centerforchildcounseling.org, and we have resources, or you can submit a form if you want somebody to contact you. Just reach out if you need some type of support. We have workshops, we're in schools, we're in child care centers, lots of information on our website. And if you can't find it, send us an email at info@centerforchildcounseling.org, and we'll get you connected.
Fantastic.
Renee, thank you.
Thank you.
Thanks
so
so much.
grateful
Thank
to
you.
you.
And thanks everybody for listening. Thank you, Dr. D.
Thank you, Dr. D.
And I'm looking forward to seeing everybody next time on The Hanley Effect.
Bye, everyone.
Bye-bye.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.